Good morning, everybody. So it's just one of those mornings I wake up with a loss of voice. So this is where breathing can kick in. Instead of dwelling on it, instead of overthinking on it, I can use the breath to help make myself comfortable so I can talk to you guys this morning. And breath has always been my go-to. So in terms of my interpretation of breathing was, I remember Julia Bradbury asked me about 6 months ago. She says, breathing changed your life. And I said, no, I don't think so, Julia. And I was only thinking about it afterwards. And I actually think, yes, breathing changed my life. And it's times like this that breathing can change your life, because you will all go through different times and having breathing there to fall back on. And there's a comfort in knowing that the challenges that you face or the situations that you have to put yourself into, you can do that because your breathing is not going to let you down. Now, that is something that everybody should know. That should be taught in schools. I remember going into exams, I would be highly stressed going into the exam, and it was my stress levels that would have affected my marks. I had very poor energy. I left school at 15, never to go back. And I was the kid who was sitting in school, and even though I would be looking at what the teacher was saying, my attention wasn't on what the teacher was saying. I was a child sitting there with my mouth open, with my attention stuck in my head. Now, I came across breathing in 1998. By the way, I did go back to school, and I did work to get into university. And I got into university, I got my degree, I got my master's. It could have been a whole lot easier, because education, in order to get through education, you need to be able to concentrate and focus, but education doesn't give you the tools to concentrate and focus. And if I talk about concentration, I'm talking about the ability to get out of your head, to be able to put the thinking mind aside, to be able to direct all of your energy and attention on what you are doing. In 1998, I came across a newspaper article. It talked about the importance of nose breathing, light breathing, slow breathing. Bring it into your way of life. I did that. I started taping my mouth. It changed my life. For 22 years, breathing has been a big part for me, even if I was never to teach one person. Now, breathing for many, many people is a minefield. It's a little bit like the Wild West at the moment. And sometimes even I'm confused, because I see so many claims and I see so many breathing techniques and so many different spectacles. And sometimes I think breathing isn't about a spectacle. There's nothing to see. You know, if I was preparing for myself here this morning, I was doing my thing, but there's no show. But it's something that I have inside, and you all have it inside as well. So what I want to do is I want to talk about the science. I want to help bring it into you to make it so accessible. And I also want to give you some breathing exercises, because ultimately you could have 100 different breathing exercises. We work with about 25 breathing exercises. So 25 different techniques, depending on what I want to get with the students that I'm working with. But it's knowing what to do in the circumstances and knowing what to teach to the person who needs it most. And that's what I would like to talk about. And I will bring in the science too, because ultimately my goal for 22 years, there is something huge in breathing, but yet it's not out there yet. There's only a small percentage of the population who know how to use breathing training to get the most out of their life. Most of us are stuck in our heads. We have been trained how to think. We have not been trained how to stop thinking. We have not been trained how to deal with challenging situations. We have not been trained how to deal with stress, and we have not been trained how to reach our full potential. Our education system has let us down. You cannot just teach people how to think without giving them the tools to be able to step out of the thinking mind and to bring a quietness to the mind. And this is going beyond mindfulness. This is not just about mindfulness. You could do all the mindfulness in the world, but if you have an underlying sleep disorder breathing, or if your physiology is in fight or flight, mindfulness is not going to cut it. Mindfulness will not work for the very person who needs it the most. I will say that because I've worked with 3,000-4,000 people just with anxiety and panic disorder. Now, I put a fair few of them into a panic attack, but I didn't mean to do it. But this is what I learned. See, the thing about breathing is, when you work with people, you learn things. This isn't just about a textbook. This is the experience. Breathing is the experience of it, but it's not the spectacle. We have to think about breathing the way a personal trainer would approach their clients. If you went to a personal trainer, what's a personal trainer going to do? They're going to prescribe an exercise protocol for you based on your age, based on your state of health, and based on your fitness levels. Because the personal trainer knows there's some people who need to crawl and there are some people who can sprint. The personal trainer isn't going to get everybody to sprint. Breathing has that variance as well. You can crawl with breathing or you can sprint with breathing. What happens if we get people who should be crawling but we get them to sprint? They're going to crash. And they're not going to take up breathing, and it puts a bad name on breathing. It puts a bad name on breathing because people think that breathing is breathing and everybody is doing the same thing. It's not. There's a massive difference. There's a huge difference between one technique and another, especially if it's not tailored. Effective communication. We need to make breathing accessible to normal individual people. I'm just a normal person up here. But the language that if I was to get a buy-in with breathing, I have to be communicated in a way that I would actually get it. But oftentimes that doesn't happen in the breathing world. And again, we do need to make it mainstream. The language and the communication is very important. Problem solving. What happens when you meet some stumbling blocks and there's some frustrations on the way? You don't have time. We don't have time for all of this stuff. We don't have time for physical exercise, for meditation, for breathing exercise. How do you do it that you make it accessible for you? That you're working with your students, and even for your own lives, how do you bring breathing into your way of life? Breathing is not a formal practice. State of mind isn't a formal practice. It's not something that you do formally. Your life is your breathing, and your state of mind is your life. And breathing is a big gateway into your state of mind and the entire nervous system. Adaptability and customization, again, according to age. Once we hit 60, we shouldn't be doing the extreme stuff. I used long breath holds for 22 years. We lower blood oxygen saturation to about 85%. Sometimes it goes into the 70s, but we don't want it to go there. That's a severe stress. We don't do it with people over 60. Why? Because I know it's a stressful technique, and I don't want to do that because I don't want to make a mistake. For me, safety is very important. And I've had about 8,000 clients through my doors over the 22 years. I don't work so much now with clients because a lot of my work is with instructors. But it's the experience of working with the clients that I want to impart to my instructors, because I made mistakes and I don't want my instructors making the same mistakes. But also for you. I've had people coming into me 60 years of age plus. They're doing major hyperventilation and they're doing long breath holds. And I say, I don't know if this is suitable for you. You know, there's a time that our body is able to do this, but there's a time that our body is not. That's a sprint. If you're 60 years of age, unless you're highly trained and you're able to sprint, sprint. Otherwise, tailor exercise according to you. And of course, part of our job and part of the personal trainer's job is to motivate their clients. And that's the key. This is the communication. Now, breathing instructors are no different. Our job is to make breathing absolutely to communicate it in a way that's accessible to the person and to tailor it to the person and to motivate them and for them to bring it into their everyday life, because then it becomes mainstream. There is something too good in this. And I have to ask the question, why has it not happened? Even in this room here, it's a capacity of 550 people. It should be full. It should be full, because that's where I really want to go with it. So the science with it is pretty simple, really. Now, there's probably more dimensions, but overall, if a researcher is looking at breathing, they look at breathing from 3 different dimensions. They look at breathing typically from a biochemical dimension, a biomechanical dimension, and a psychophysiological dimension. And the nose is the one thing that brings everything together. Now, I know this sounds so simple, but even if you switch from mouth to nose breathing, you're on the right track. Now, I remember I was doing an interview with Chris Evans there about 2 months ago, and in the taxi, I was just curious. I was looking out the window and I was saying, okay, in London, how many people are walking by with their mouth open? And I would say it was about 30%. So there's 30% of people on the streets in London walking with their mouths open. Why? You don't need to have your mouth open while you're walking. You don't need to have your mouth open during light to moderate physical exercise. Your nose does all the work. Your mouth does nothing. What's in your mouth? Your teeth, your gums, your hard palate, your soft palate, the back of the throat. None of those things do anything for your breathing. They are for eating, they are for drinking, they are for speaking, and if you're lucky enough, they're for kissing. That's it. That's what your mouth does. So your nose does everything for the breath. And the human nose has 30 functions, but yet we are not taught to breathe in and out through the nose. Start with the simple stuff first. Never wake up with a dry mouth in the morning. And that's another thing. Don't do mouth taping, but do nasal breathing support. And the only reason that I'm going to put this out, I have been taping people's mouths for 22 years. About 4 years ago, we brought together a nasal breathing support tape. And the reason being is people with moderate to severe sleep apnea, if we tape their mouths, it can increase their sleep apnea severity. There's also a perception. If we are going to be making this mainstream, we have to move away from covering the mouth, because that is never going to happen. We do want nose breathing during sleep without question, but we want it safely. What about the children? So that was in our effort to help bring children's lips together by using a support surrounding the mouth to bring it together, but it's safe. And especially people with anxiety, people with panic disorder, we have to think of the everyday person and we have to think about safety. A biochemical dimension, if you hyperventilate, you lose carbon dioxide. This drives up blood pH. This is a stressor. Hyperventilation is a stressor. If you hypoventilate, if you underbreathe, what does it do? It improves your blood circulation and oxygen delivery. It stimulates the vagus nerve. It reduces your chemosensitivity to carbon dioxide. It puts you into a slight psychological response that you have to surrender to it. There's a lot going on with both sides. So what do you want to do when it comes to breathing? Do you want to hyperventilate, to upregulate, to stress? Or do you need to downregulate? And this is the thing. What's for you? For me, I downregulate. I love the downregulation. And if I want to upregulate, I'll do long breath holds during movement. So again, it's just having an understanding there of what's actually happening. I always had cold hands and feet. Many of you have cold hands and feet. Cold hands are not just because of a warm heart, but cold hands are synonymous that your blood vessels are constricting due to a breathing pattern every day of breathing a little bit too fast and or hard to cause an increase in minute volume. In other words, we too develop a habit of over breathing. You're all comfortable, you know about the habit of overeating, but what about the habit of over breathing? How many of us overbreathe? It's pretty common. It's pretty common. You know, in the general population, a Cochrane review said it's about 9.5% of the population. Kyle Kiesel, professor of physical therapy from Evansville University in the States, he said it's about 25% of the population, 1 in 4. And then we look at other reports, 75% of people with anxiety and panic disorder having dysfunctional breathing, 75%. It's not just the stress and the trauma and the difficult situation that's feeding into our breathing patterns, but our poor breathing pattern is feeding back into the difficult situation, and our poor breathing pattern is feeding back into poor sleep, and our poor sleep is not giving us the capacity to be able to cope with the challenges that we face in daily life. This is breathing. If you want to improve your blood flow, breathe less. If you want to improve your oxygen delivery, breathe less. If you want to reduce your chemosensitivity to carbon dioxide so that when you do physical exercise with less ventilation, breathe less. If you want to train your body to go harder and faster with less ventilation, breathe less. And I will give you a story. People sometimes say to me, it's absolute nonsense breathing through your nose during physical exercise. Check out a guy called Ihor Verys, Ihorverys. He completed Barclays Marathon this year. And since 1986, only 26 people have completed this marathon. It's 60 hours of running pretty much. It's a very gruesome terrain. There's no paths, no nothing. All you have is you have a compass and you have a map. And the course is so difficult that the organizer said that a woman will never complete this course. And the woman did complete it this year, a Scottish woman, Jasmine Paris. But the person who came in first was I. Hervaries. What is his secret weapon? Nasal breathing during physical exercise. Why? Now, he only came into breathing about 4 years ago, but he had read the Oxygen Advantage book. He put everything into practice. Because he's Ukrainian as well, he looked at the background of Dr. Buteyko, and he trained his body to do more with less. He became so efficient that he could do this 60 hours of physical exercise, but he had so much recovery in terms of he was able to snap those 10 minutes, those 5, 7, 10 minutes, depending on how fast you are, every hour. There is a room for nasal breathing during physical exercise, and I'm going to make a prediction. This is the next big thing, because there's so much going on when you breathe through your nose during exercise. Your physical exercise isn't just a training for the body. It's a training for your breathing. You know, if you think about when you do physical exercise with your mouth closed, yes, the air hunger is a little bit stronger initially because carbon dioxide is higher in your lungs and blood. But when you expose your body to the increased carbon dioxide, your body adapts to it. With a higher tolerance of carbon dioxide, then when you do physical exercise, you don't need so much air. You're more efficient. It's not just about the air that's coming into the body that's the key. We all think about what's coming into the nose or what's coming into the mouth. That's not it. It's really about that volume of air that's getting down into the small air sacs in the lungs, the alveoli. And what about the oxygen transfer from the lungs into the blood? But more importantly, do you know how to breathe to improve oxygen transfer from the blood to the tissues? So even though you do your physical exercise with your mouth closed, you're breathing less air, probably about 20% less air. It doesn't mean that you don't have sufficient oxygen to the tissues. You do, because with nose breathing, you have slower breathing, you have deeper breathing, you have better alveolar ventilation, you've got better gas exchange, 10% increase in oxygen transfer from the lungs to the blood by breathing continuously through your nose, known since 1988. And what's more, the Bohr effect. When you breathe through your nose during physical exercise, we produce more carbon dioxide. That's what generates the sensation of air hunger. But as carbon dioxide is increased and produced by the body, and that carbon dioxide is coming back to the lungs, and because we're breathing through the nose, we can't get rid of all of the excess CO2. So there is a slight accumulation of carbon dioxide in the lungs, which in turn increases the carbon dioxide in the blood leaving the lungs, which dilates your blood vessels. 50 to 60,000 miles of blood vessels in the human body. And if you do your physical exercise with your mouth closed, your blood vessels dilate. You have a better circulation. But you also have another thing. Carbon dioxide is the primary catalyst of the release of oxygen from the red blood cells to the tissues. So when you're breathing with your when you're breathing through your nose during physical exercise and there's an increase in carbon dioxide in the blood, there's a slight drop to blood pH and hemoglobin releases oxygen more readily. Always think about physical exercise. It's not just a training for your body, but it's a training for your breathing. But I want to go one step more. I am up here with a capacity to be able to put my thinking mind aside. And yes, as thoughts come in, it's not thinking. And this capacity is because I simply bring it in when I do. I only do 30 minutes of physical exercise a day. That's all I do. I don't have time for breathing practice, for physical exercise, for meditation. Just don't have time. There's too much going on. Most of you are going to be the same. We don't have time. But how about you do your 30 minutes a day or 1 hour, whatever you do every day, with your mouth closed? Then it's a good breathing training because you're adding a resistance to the diaphragm to help strengthen it. You've got better recruitment of the diaphragm. You're also helping your breathing from a biochemical point of view. And from a psychophysiological point of view, if you do your physical exercise with your mouth closed, you will have an increase of blood flow to the brain by about 10%. Now, how do I give you that figure? Every 1 millimeter increase of CO2 will increase blood flow to the brain by about 3 to 4%. If you do your physical exercise with your mouth closed, you will have an increase of carbon dioxide in the blood for about 3 to 4 millimeters of mercury pressure. So you have about 10% increase of blood flow to the brain. The human brain needs 20% of your oxygen. It's 2% of our body weight, but it consumes 20% of our oxygen. It's 15 to 20% of our cardiac output. The brain needs fuel. If you're going around with your mouth open, you don't have an increase of carbon dioxide in your blood. Why? Because you're breathing it out. You keep your mouth closed. There's a slight accumulation in your lungs. There's a slight accumulation in your blood. Your brain is getting more blood flow and oxygen delivery. What does that do to the brain? It has a calming effect. The brain, by controlling breathing, regulates its own excitability. Nothing new is here. I've come across papers going back to 1924, looking at carbon dioxide and its role in helping to prevent seizures with epilepsy. And now there are new papers brought out in terms of in mental health. And most people, when they come to breathing for one thing: to get out of their heads. That's why we do breathing. Hyperventilation will get people out of their heads. That's why they love it. But also hypoventilation. Why? Because it's improving blood flow, it's improving oxygen delivery, and it's helping to quieten neuronal excitability. We have 80 billion brain cells. Each brain cell is communicating with 15,000 other brain cells. But if we breathe a little bit too fast and or too hard, we have increased brain cell excitability and we have increased thought activity. Can you learn to stop thinking? Yes. Why can I say that? Because I do it myself. Of course, thoughts come in, but thoughts and thinking are not the same thing. I am not thinking up here. I am with you. My attention is moving simultaneously with time. And that's just about, not necessarily from what I did this morning, but that's just from bringing simple tools into my everyday life, because I spent many years stuck in my head. Many years going from thought to thought. And the thing about that is, when you're stuck in your head all the time, we're not using our ability. Because how can we produce any sort of quality of work if we don't have the capacity to hold our attention on what we are doing? It's not just about going through the motions. It's about doing something with every cell of your body. Then you know that there's a quality in it. When you do something with every cell of your body, you produce great work. And when you produce great work, you're going to be successful. So, when I do my 30 minutes of physical exercise a day, I bring my attention inwards and I hold my attention on my breath or in my body. My physical exercise is my meditation. I don't have time, but I don't believe in the formal practice either. I also will bring my attention into my body at different times throughout the day. I always will. I think it's not just about this formal practice. Sometimes we see this image of somebody that's looking so surreal. They're looking so beautiful and so calm. Oh, wonderful. It's a great post for social media. That's not what it's about. What about your life? What about your everyday life? What about the situations that you confront yourself with? This is where breathing is. How comfortable are you with connecting with your breathing, knowing that you have it there to self-regulate and to get out of your head, but more importantly, to be able to direct your entire attention. And of course, yes, the mind wanders, but you bring your attention back. That's the psychophysiological point of view. So now, when it comes to breathing, you could have 100 different breathing exercises on the table. What are those breathing exercises doing? Always ask, what is the breathing exercise doing from a biochemical point of view, a biomechanical point of view, and a psychophysiological point of view? That's breathing. And the importance of this is not just to think that breathing is about the biomechanics. What about the biochemistry? People often breathe with poor recruitment of the diaphragm. So they're breathing very much in their chest. So they're breathing high instead of breathing low. And a paper by the Journal of Strength and Conditioning Research looking at 1,933 athletes in Japan from 2017 to 2020. 90% of athletes, regardless of age, regardless of sport, and regardless of level, even professionals, 90% had dysfunctional breathing. From a biomechanical point of view, they were breathing too high. Now, what is the problem with that? Well, your diaphragm is not just for respiration. Your diaphragm is for stabilization of the spine. Your diaphragm is for movement. But if you have dysfunctional breathing, you have dysfunctional movement. And if you have dysfunctional movement, you're at a greater risk of injury. But if you're breathing also with your upper chest, you're more likely to be breathing faster. So those athletes then are more likely to gas out during physical exercise, but also in our everyday breathing. If we breathe a little bit fast and heavy in upper chest, what's our body telling the brain? Our body is telling the brain that we are under threat. Our brain is spying on our breathing. Your brain now is spying on every breath. This was discovered in 2017 by Stanford Medical School. What do you tell your brain? Do you tell your brain that you're under threat, or do you tell your brain that you're safe? It's very important to be able to tell your brain that you're safe. How can you do that? Take a soft breath in through your nose, and a really relaxed and a slow and a gentle breath out. Don't even time it. And the reason being I'm saying don't time it is because what might work for you is not going to work for you. I don't believe in this 4 seconds in and 6 seconds out for everybody. It's not going to work. Because if you have somebody with a respiratory rate of 20 breaths per minute and all of a sudden you bring them down to 6 breaths per minute, the fall is too much. And what they will end up doing is increasing their tidal volume and increasing minute volume, and it'll actually be the worst thing that they could do. So the instruction to take a deep breath can be very, very not damaging, but it's not, the instruction is good, but the interpretation of it is not good. But coming back to that, so if I was going into a situation and I feel my heart rate is a little bit elevated, and I want to tell my brain that I'm safe, because that's all the human brain cares about. The human brain has one primary purpose: survival. That's it. It doesn't care about anything else. Everything else is sacrificed for survival. We have to be careful with what we tell the brain. If we breathe fast, if we breathe upper chest, if we have our mouth open, we're constantly telling the brain that we're in fight or flight. So if we want to tell the brain that we are safe, even as you're sitting there, what I would like you to do is bring your attention out of your mind and into your body. You might feel the airflow coming into your nose. You might feel it at the back of the throat. You might feel your chest rising and falling. You might feel the area of the diaphragm. Just simply take a small, normal, soft, we'll say a soft breath in through your nose. We shouldn't hear it. Soft breath in through your nose, and a really relaxed and a slow and a gentle breath out. Slow your breathing relative to how you breathe. Don't worry how well you're doing it. Just take a soft breath in through your nose, and as you're breathing in, almost as if your breath in is imperceptible, and then as you're breathing out, bring a total feeling of relaxation to the body and have a relaxed and a slow and a gentle breath out. Now you're telling your brain that you're safe. You're stimulating the vagus nerve. As you stimulate the vagus nerve, it secretes acetylcholine, which causes a slowing of the heart, and the brain interprets that the body is safe. It's very, very important. People who are unwell, there's always a degree of anxiety associated with chronic health conditions, and of course, we all have some degree of chronic stress going on in our lives. That's the nature of modern living. But a tremendous tool is tell our brain that we're safe. Now, I would like you to underbreathe here for a little bit. So now what I would like you to do is to go just beyond what we did. We're going to look at biochemical dimension, but from a hypoventilation point of view. So what I would like you to do is, what happens when you breathe less air for about 3 minutes or 4 minutes? How do you know that you're breathing less air? You feel air hunger. And this is an exercise that I came into, and I started noticing the change in the temperature of my fingers. Now the room here is quite cold, you may not feel it, but this could be something that you practice at home. So again, don't worry about how well you're doing it. Don't worry about that. Just, we keep it very simple. As you feel the airflow coming into your nose, soften and slow down the speed of the air as it comes into your nose. So it's almost as if your breath in is imperceptible. And then you have a really relaxed and a slow, gentle breath out. And the whole purpose is that as you breathe in, don't take 100% of your breath in. Take in about 80%. So take in about 80% of the breath in, and then have a relaxed and a slow and a gentle breath out. And I need you to soften your breathing to the point that you feel that you are not getting enough air. The feeling that you're not getting enough air signifies the carbon dioxide has increased a little in the lungs and blood. It's not a deprivation of oxygen. In actual fact, during this exercise, pay attention to the saliva in the mouth, pay attention to the feeling of air hunger, and pay attention to the temperature of your body, especially the hands. Are you able to influence your blood circulation and oxygen delivery? It's not about the volume of air you take into your body, that's the key. So let's continue. So you're taking a really soft, slow, gentle breath in through your nose, and a relaxed and a slow and a gentle breath out. The length of the exhalation should always be quite a bit longer than the inhalation. Ideally, ratio of 1 to 1.5, 1 to 2. And again, bring your attention back onto your breathing. And if you notice that your mind is wandering, this is also good training for your mind. You're taking a very soft, slow, gentle breath in through your nose, and a really relaxed and a slow and a gentle breath out. You're doing it correctly if you feel air hunger. And air hunger is a very positive thing. There's a slight psychological stress with air hunger, and air hunger is a primal fear. And now, right now, you have a controlled dose of psychological stress that you're training your brain not to react to discomfort. It's very, very important. This is quite subtle. There's nothing for anybody to see. But this is the beauty about it, because you can do it in any situation. Having that tool, you're going into an interview, your breathing is fast, your heart rate is elevated, that's not a good position to be in. How do you tell your brain that you're safe? Soft breath in through your nose, and a really relaxed and a slow and a gentle breath out. Now, if you do it with your eyes closed, with your eyes directed out, almost as if there's a roof light in the top of your head. Now, normally what I do is I bring my attention to the back of the head, because that's how I can stop thinking. The back of the head, and I only found it out about 3 months ago. I was talking to a guy called Eddie Stern. I was saying, Eddie, yeah. And in terms of bringing a quietness to the mind and getting out of the thinking mind. And I said, Eddie, about 22 years ago, I was practicing this and I felt a slight pressure at the back of my head. And when I felt that pressure at the back of the head, my thinking mind was quietening. And I said, every time I go out on stage, I always do it, because I know when I bring my attention right to the back of the head and hold my attention there, I'm fully in the moment and my attention is moving with you. And he says, yeah, what you're doing is, he says, you're taking your attention to the brainstem. And of course I say, yeah, it makes sense, because the brainstem is the primitive brain and it's not a thinking mind. So anytime that you want to take your attention out of the thinking part of the head, bring your attention to the back of the brain. Now it works, and I would say, for me, it works all the time. I can't be any different to you. When I was practicing that exercise, that is my go-to exercise. We use 25 different techniques. So in terms of taking that really soft and slow, gentle breath in and the light and really slow, gentle breath out, you're improving your blood circulation, you're improving your oxygen delivery, you're telling your brain that you're safe, you're reducing your chemosensitivity to carbon dioxide, you're anchoring your attention onto your mind, which is also getting out of your head, but you're improving blood flow and oxygen delivery to the brain. That's biochemical with hypoventilation. Now, if you want to get out of your head and you have a reset and you want to experience all of the benefits of hyperventilation, you can also do that too. But they're two different extremes. They're two different sides. So there's a purpose for everything. And this is the thing. What works with you? How do you know if you're making progress with your breathing? There's 3 tests: BOLT, high-low, Nijmegen questionnaire, self-evaluation of breathing questionnaire. Any breathing techniques that you are practicing, how do you know if those breathing exercises are suitable for you? Are they achieving your goals? Are they improving your sleep? Are they getting you out of your head? Are they improving your ability to do physical exercise? Or if you have a situation that I had, loss of voice this morning, I used breathing. I wouldn't have been up here otherwise. I used breathing because I knew it was my go-to and there was a comfort in knowing that. High-low test is your biomechanical dimension. BOLT score is the body oxygen level test. This is the length of your comfortable breath hold time. And the Nijmegen questionnaire and the self-evaluation breathing questionnaire, this is assessing your breathing from a psychophysiological point of view. Why do I put these out here? Because then you know that if you are bringing breathing practice into your way of life, there is a way to gauge if your breathing is going in the right direction. Very often, I come across somebody, they are doing the wrong breathing exercise. How do we know? Because their scores are going down. Your scores, if you're practicing breathing, your scores should not be going down. What's your BOLT score? I've only about 3-4 minutes. Your BOLT, the body oxygen level test, is a test that has been around since about 1975. It's a pretty good physiologically based test. and it's very simple. I'll just explain it to you. You can try it in your own time. Don't worry about what you get. It just gives you feedback, yeah? Take a normal breath in through your nose and a normal breath out through your nose, and pinch your nose and hold your breath, and you time it in seconds how long you can hold your breath for comfortably. And then you let go. And when you let go, your breathing should be normal. So it's not a maximum length of your breath hold time, because that would be influenced by willpower and determination. It's the length of your comfortable breath hold time. Now, what's the significance of it? If your Bolt score is less than 25 seconds, your breathing is likely to be dysfunctional. If it's about 22, 23 seconds, you're pretty much there. But if you're down around 10 or 11 seconds, it means that your breathing is faster, harder, upper chest. So 11 seconds, this is what we see. 25 seconds, this is what we see. So it was a simple screening tool to assess your breathing. And there has been a recent enough study by Professor Kyle Kiesel on this, looking at 51 individuals. Because again, breathing is complex, so could you narrow it down to a simple breath hold time? That's why we have used Bolt score or control pause in Buteyko since 2002. Because yes, it's not perfect, but it's a pretty good indicator. If you have an athlete with a low Bolt score or an individual with a low Bolt score, they're more likely to be breathing faster, irregular, harder, upper chest. They feel that they are not getting enough air. You know these people. If you're a health professional, if you're a fitness professional, you know these people. What's the issue here? Their breathing is poor from a biochemical point of view, possibly from a biomechanical point of view, and possibly from a psychophysiological point of view. But the biochemical is very, very important. People with long COVID, their breath hold time is down to 3 and 4 seconds. Total dysregulation of the autonomic nervous system. This will give you feedback of your autonomic nervous system. A higher breath hold time is advantageous. Now, when we think about breathing, match it relative to your Bolt score. As I said, think of the personal trainer. The personal trainer is going to tailor a breathing technique based on the age, based on the state of health, and based on the fitness level of the individual. We as breathing instructors have to do the same. Why? Because this is a way of getting this out into the general public. Breathing should not be just for a small select group of people. The tools to be able to self-regulate, improve your sleep quality, get out of your head, we should all have access to those tools. And we do, if breathing is instructed correctly. Now, that is my goal. And that's the goal of Oxygen Advantage. We have seen it over the years. And in an effort with this, so it's coming back to this, we are at stand C8. We do have an Oxygen Advantage app, which is entirely free, and everything inside it is free. All of the exercises for children are online. They are entirely free. Why do we put out so much information for breathing for free? Because I don't want breathing to be just the domain of a few select innovative people. I need this to get mainstream. Why are we letting our children mouth breathe, our teenagers? Why are so many people suffering, stuck in their heads and not being able to get out of their heads and not having an ability to self-regulate? I'm not saying that breathing is the cure, but I am saying this. If it is properly dosed and prescribed, it can be life-changing. It was life-changing for me, and you are not going to be any different. Thank you very much. Yes.